lead at the Policy Exchange organisation, and that is Richard Sloggett, who joins us on the line now. Richard, good afternoon to you.
Good afternoon.
That opinion surely has been skewed by the events of the last couple of months.
Absolutely, Martin. And I think what we're seeing playing out through the pandemic, tragically, is decades of funding and policy neglect on social care. And as you say, that plays through into the study that we've launched today with the IPPR think tank. And the study found that 61% of those we polled think that we've spent too little over the last few years on social care, and that action is desperately needed to address it. But also that we, as you said in your opening remarks, that there is a fear and anxiety about the sector now, which this pandemic has exposed, and there is a collapse in confidence in care homes and residential care in particular, which will be difficult to address.
And the idea that these things have got to be paid for somehow, I know it's now folded into, well, COVID's got to be paid for somehow. But if we try and separate the two issues out, is public sentiment moving on that? Whereas people might have thought, oh, not another tax, I pay enough tax. Do you think people are more sympathetic to paying a bit more to look after the elderly?
Yes, that also comes through loud and clear in the polling that we've done. There's a very strong desire that this is funded from general taxation like the NHS. So then there is very little appetite for specific taxes such as a home tax, so a tax on your estate, which obviously we saw play out sort of quite negatively in the 2017 general election. So a strong support for a general tax such as that, which would fund the NHS. And what's perhaps most encouraging is that this is not seen as a left or right-wing issue anymore. This is a genuinely cross-party, there's a cross-party consensus here. So whether you're a Labour voter or a Conservative voter, the numbers are pretty much neck and neck on the approach that needs to happen.
Well, that's an extraordinary turnabout, isn't it? Because this item, this matter, has dogged administrations of whatever colour. I think I saw a clip on the back to the Blair days, even in '97, with all his landslide majority. In the event, he didn't manage to nudge the policy needle very much, did he?
That's right, and as I stated, I think this has been an ongoing challenge that Whitehall has not been able to fix. I think there is now a chance, as you say, with the pandemic, and there's some big structural decisions that are needed on the economy and on our healthcare sector to take some big and bold decisions. I think the government went into the election with a kind of commitment to talk on a cross-party basis, and what this study today shows is that there is a cross-party consensus should they wish to go for it.
And I wonder this question about hypothecated taxes, because we don't actually pay the National Health Service tax, do we? We don't know really how, in the great pot of government money, it's very much down to the politicians of the day to decide how much of that pot gets allocated to the health service. In the same way, do you think it will be helpful for people to see, and this portion of your income tax or whatever it might be, this portion of your national insurance is actually paying for social care? Does that help?
I think the transparency around taxation is an interesting one, and I think the government has sort of tried to make understanding tax policy for the average voter much easier. I think what we've found is that voters are most keen to see social care and the NHS be brought much more closely together and have similar approaches to how they are funded, and that comes through in the study today.
Now, you're a former advisor to Matt Hancock, so you know a bit about this, right? You must have done some of the work in government on it.
Yes, and there's been a long-standing commitment to publish a green paper, which has not yet been published.
I was going to mention that. Why not?
Well, I think one of the challenges with this is it's not been clear where the consensus is, and there's been a series of options put forward that have not quite materialised. I think one of the reasons we've done the study today with another think tank from the left of British politics, the IPPR, is to show that actually this is no longer a sort of right-wing or left-wing issue. This is a national issue which requires national unity and a way forward on a similar basis to the NHS.
Richard Sloggett, good to talk to you. Thank you very much.